In this video, I'm going to discuss COVID-19 and how it impacts those living with dementia as well as their caregivers, and provide some tips and resources available free of cost from the Alzheimer's Association. Currently, it is believed that dementia does not increase risk for COVID-19, the respiratory illness caused by the new coronavirus, just like dementia does not increase risk for the flu. However, dementia-related behaviors, increased age, and common health conditions that often accompany dementia may increase risk. For example, people with Alzheimer's disease and all other dementia may forget to wash their hands or take other recommended precautions to prevent illness. In addition, diseases like COVID-19 and the flu may worsen cognitive impairment due to dementia. The Alzheimer's Association has multiple resources available related to dementia and COVID-19. These resources are available at alz.org/COVID-19. Now that we understand that those living with dementia may have difficulty remembering prevention techniques, there are some simple actions caregivers at home can take to help with this issue. As a reminder, always remember to follow CDC guidelines when considering the following tips. First, signage. People living with dementia may need extra or written reminders and support to remember important hygienic practices from one day to the next. Placing signs in the bathroom and other areas such as the kitchen can help remind people with dementia to wash their hands with soap for 20 seconds. Second, lead by example. Demonstrate firsthand thorough hand washing. Remember, for people living with dementia, increased confusion is often the first symptom of any illness. If a person living with dementia shows rapidly increased confusion, contact your healthcare provider right away for advice. Also, be proactive about prescriptions to reduce risk. Ask your pharmacist or doctor about filling prescriptions for a greater number of days so you can reduce how often you need to go to the pharmacy. It is important to plan ahead. Thinking of alternatives for daycare, respite, and care management and documenting those possibilities now will make implementation much easier if there are cancellations or illnesses related to COVID-19. If your family member is in assisted living, the CDC has provided guidance to facilities on infection control and prevention of COVID-19. Remember that the decisions and restrictions at these facilities are for their safety. Check with the facility regarding the procedures for managing COVID-19 risk. Ensure they have emergency contact information and the information of another family member or friend as a backup. Do not visit your family member if you have any sign or symptoms of illness. Understand that, depending on the situation in your local area, facilities may limit or not allow visitors. It can be difficult if you are unable to see your family member. But remember that limited or canceled visitation is for the protection of your family member and the other residents at the facility. If a facility does not allow visitation, inquire about other methods of checking in, including video chats, phone calls, and letters. If your family member is unable to engage in calls or video chats, ask the facility how you can keep in touch in order to get updates. Family caregivers may need to adjust usual routines, and it is important to continue to engage the person living with dementia, whether it be including them in a regular task or planning activities that you both enjoy. Creating a plan, spending time thinking about a schedule for the day, can help you and the person living with dementia make these adjustments. If you are a caregiver, it is more important than ever for you to find ways to take care of yourself, even if it's brief breaks to take a walk, read a book, or do something else that you enjoy. Things like physical activity, learning relaxation techniques, or just taking a 15-minute break for yourself can all be extremely beneficial. The Alzheimer's Association is here to help caregivers and those living with dementia, and our dedication has not changed due to COVID-19. Our 24/7 helpline at 800-272-3900 is available around the clock 365 days a year. The helpline can put you in touch with specialists and master's level clinicians that offer confidential support and information, whether you are a person living with the disease, a caregiver, or a family member. In response to COVID-19, the Alzheimer's Association has transitioned all of our in-person programs to virtual programs, either by webinar or phone. These programs are available to you for free, and you can find more information about them at communityresourcefinder.org. So thank you once again for watching my presentation today over COVID-19 and caregiving. I hope it was helpful for you. Just a reminder, our Roswell Walk to End Alzheimer's is coming up on October 3rd. And if you've made it through both of my videos all the way to the end of this one, we have a special giveaway offer. So if you sign up for the walk today, the day of the event, the first 5 people to sign up the day of the event after this video is posted will get a free goodie bag, and we'll show you a little picture here of what that looks like, and we will mail that to you if you registered for the walk today. With that in mind, I just wanted to share a little clip of why our walk is important to get you excited for that event coming up again on October 3rd. Thank you again so much for your attention and watching these videos, and have a great day.
This year, the Alzheimer's Association Walk to End Alzheimer's is everywhere. On every sidewalk, track, and trail across this country. All of us are raising funds for one goal: a world without Alzheimer's and all other dementia. Because this disease isn't waiting, neither are you. Take the first step on your walk right now. Go to alz.org/walk.